One of the overarching theme this Equity Week was the need for accurate data, the need for data that is accessible to both to policy implementers and to policymakers and to other stakeholders.
I think a starting point is that, you see, data is about numbers. And what numbers tell us, for instance, how many children are being immunized or have been immunized, how many children are malnutritioned, how many children or how many women have access, you know, to safe delivery areas and facilities. It tells us how many people have access, for instance, if it's a case of HIV and AIDS, to ARVs and where. But data also shows us where those needs are. So for instance, there could be an issue that malnutrition is a problem, but it's only a problem in a certain area. So that's what data does.
Inequality, equity, access to resources, services is a big and enduring question. But the problem is that it's been stripped of data and evidence, and it's all happening based on people's whims and anecdotes and stories they tell each other. And I think what we are trying to do is really provide some real concrete conversations that we have. We are not the same people, that's for sure. There are counties that look very different from the others. And yet we have the same geographic boundary, we hold the same passports, we vote in the same elections, but the outcomes of that political process has not created equitable access to goods and services. So there's a deep basis for grievance that we see across the county. And I think this is what the data is showing. The problem is that these things have not informed the political conversation. So the politics is on other things. The people who should be complaining and are kicking for different reasons. They're not kicking around they're not asking, why do our mothers have to die just because they wanted to have a child? They're not asking questions like, why do kids drop out of school at numbers that are atrocious? Those are not the questions that are informing the political process. So what we also expect to do with data is to drive the political conversation to something that is more meaningful to Kenyans.
The role of data is to expose the needs and the disparities. What we do with that data, so that data is not an end in itself, you know. So data is basically, it's just an input that helps us to see the need, the problem, and that's why, for instance, we use numbers to show, to discuss issues of what interventions should have in terms of poverty levels and all that. That's what data does. It simply exposes the disparities, it exposes the needs, but it also exposes areas of coverage, so that it shows us that a certain area has immunization cover of 90%, but a certain area has got immunization cover of 20%. So that's one. But also data does something more, is that by disaggregating that data to very small, even to the level of homes, then you are able to tell whether the problem is actually across board. Because, for instance, you could go to a certain county and county indicators on a certain aspect of health, let me use immunization because I've used it before, is very good. But then if you go further deep within that county, you actually realize there are certain disparities between wards. Certain wards are very high, certain wards are very low, because many times the number you get is the average. But then even when you go to those wards, you might actually find that between different home states, you have actually differentiation, because maybe they have certain cultural beliefs that they subscribe to, and therefore that's the role of data. Data exposes, but then also there's something we call longitudinal kind of tracking. So basically what you're saying is that we check in 2010, how was the situation? Then we come and check again in 2011, how is the situation? 2012. So over time, data shows us over time whether the problem is increasing or is decreasing. And that then helps us to inform our interventions. So in a way also it helps us in terms of monitoring whether we are making progress and progress in what direction.
So data only sharpens the kinds of policies that we'll come up with, the kinds of laws that we'll come up with. If the county government is willing to change the inequalities within the county, then it's important that it appreciates different health indicators and how these are varied across the county subunits. So data plays a key role in understanding the extent of inequalities.
For you to understand where the need is, data then becomes very important. So if you're talking about health, you need to understand where the sick are. You need to understand which regions have what number of health facilities. You need to understand what kind of services are provided in these facilities, because that gives you a better idea of where to apply your resources. And so if the data is not there, then you're left with a bit of a tricky situation, because one option is simply to go with what you've done historically. So it's basically to say, we were spending 50 shillings in malaria, we'll spend 50 shillings in malaria is a safe bet. But the fact that you're actually trying to sort out an inequality, when you do what you've been doing historically, then you're not making any steps. So then data becomes very useful because it helps you make the next step.
When we look at inequalities and how then we can use data to be able to use it as a basis for projecting ideas, we're realizing that it is pretty complex. Portals that do not respond to needs is as good as not useful. And so one of the things we are trying to do is that we will try to use platforms like this whenever they become available as a basis for interacting with those who will eventually use our portal.
My name is Evans Kibet. I'm representing Baringo County, and we have our Director for Civic Education and Public Participation. So in Baringo County, we have 6 sub-counties. We couldn't do the wards because the wards are 30, there are so many. But again, the sub-counties are more familiar in terms of development index. So at the northern part of Baringo County, we have Tiaty sub-county, which is the least developed, as marked by red. But again, when it approach urban centers, there is Chemolingot, which is quite developed in terms of road infrastructure. But again, why we chose to mark the whole of the sub-county as underdeveloped is because of issues of access to water and healthcare. Then the next sub-county is Baringo North, where towards the headquarter, Kabarnet and the surrounding wards, it's developed. But then at the borders of Tiaty, at the borders of Baringo South, it's quite underdeveloped. Then we have also a big chunk of the sub-county being fairly developed. Then at the extreme end, Eldama Ravine, just to portray the inequality, Eldama Ravine is most of the sub-county is developed with good road infrastructure, access to water, with some wards even having up to 85% access to water as per the last KNBS survey. Mogotio has a mixture that is towards Nakuru is fairly developed. At the center, where we have Mogotio town, it is developed, while at the borders of Baringo South, and of course the other side towards Nakuru, it is less developed. Then Baringo South, Baringo South at the center, we have Marigat and the surrounding irrigation schemes. They make the place quite developed, but towards the border of Tiaty and Mogotio, it's less developed.
we saw from Equity Week people demanding that we need to have access to information. It is impossible for us to expect people to comment on policy issues when they are not informed. We saw that from the research on distribution of health workers that data is a huge challenge, and it is quite difficult to comment on policy issues on distribution of health workers where we don't have data on these health workers across counties. We also saw on Tuesday John saying that accessing data on infrastructure, on the roads that were being undertaken by the national government was very difficult.
So if you look at the population data we use, if you look at most of the data that we have around access to certain services, it's really data from the census in 2009. Once in a while you bump into data from 2014, but we are making decisions about 2017 and 2018. So having a way that that data is also updated where available is also a challenge that we have to face and see how to sort it out. And counties, when you speak about counties, counties have a role to do in that now. They like playing this card of KNBS should do that, but actually the County Governments Act says counties should have their own statistical offices. They can benefit from KNBS, that's all right. But there is need for us to get a bit proactive in making sure that there is data that helps us. It's not just collecting data randomly. It's to say, I am a county, I need to understand the health status in my county, because the next time I'm preparing my county integrated development plan on the next budget, I need to be a bit more specific. And then, you know, it also makes it easy for the government to explain to people why they are making the decisions they are making. So it doesn't come out as we are spending money in Ward X because that's where the governor comes from. But it's more of we are spending money in Ward X because Ward X has the worst health indicators and we need to sort that out. And the fact that people can see that, then you also manage expectations.
The biggest problem that I have, and I think it is a common problem for all of us, is the good quality data. Because a lot of this data we used the statistical abstracts, the economic surveys, and largely we used the 2009 census data, and you know that is really outdated. And so we are very excited. We are getting ready so that the moment they do the new census, we will have a place we just plug it in and play.
So now, onto the issues that I said I'll just flag out and then we can discuss. One thing, and I have spoken to this, is how do we get data on this? I'm glad he said his data is from the 2009 census, but it's now 4 years into devolution. We need to update our data. And if we're going to get data from counties, does that mean I go on a Kenya road trip and then go to every county and say, I need to know how many health workers you have because this is important for policy? There has to be some way of collecting data so that we can know if you're making strides and, you know, how does this compare? For example, if Elgeyo Marakwet has employed different strategies, how does it compare to strategies that have been employed in Samburu? Is it working? What are the challenges? Benchmarking and all that. He talked about it. So there are huge data challenges, and I thought the place to get this data was the Council of Governors, but I requested for data. This has been since June last year, but nothing from them. And then obviously the Ministry of Health was like, we don't have current data, this is what we gave them. They are doing their own things, okay? So, and then the information system doesn't help because it's voluntary, so it doesn't mean it's the most updated or the most accurate data. So it's been very difficult, but what we've seen as good practice is in these 3 counties, West Pokot, Homa Bay, and Busia, they put the number of health workers in their budgets. So these are publicly available documents, so we can be able to tell in 2014 how many doctors were there and how many do they have in 2017, and what is the wage bill like. So that's good practice, and we'll commend that for those counties because we're able to track what is changing and what is causing that change to some extent.
In a devolved system, somebody must take responsibility for collecting data from the devolved units, putting it together, and making it accessible. It is the only way for the public to engage. It is the only way for Parliament to exercise oversight. It is the only way for national policymakers to make intelligent decisions. The truth is that today, If you want data from the counties, you have to go to each county and get it. And that is ludicrous. That is not the way it works in other countries, and there's no excuse that that is the way it is working today in Kenya. When we made this point to the controller of budget, many years ago, I've given up making this case to the controller of budget, that the controller of budget should be responsible for creating the national repository of county budgets so that everyone can see the county budgets sitting wherever they are sitting at the click of a mouse. We were told that is not our responsibility. It is the county's responsibility to make information available to the public. Yes, it is the county's responsibility to make information available to the public. But the truth is that anybody who wants to know, sitting not just in Nairobi, but sitting in Kwale, sitting in Turkana, sitting in Kisumu, what their neighbors are doing, what the other counties in the region are doing, how Kisumu compares to Mombasa, cannot be expected to go to each individual county to request for information. This is simply not feasible. And therefore, if we expect devolution to work, again, what is the theory? The theory behind the decentralization of resources is that counties or subnational units will compete with each other to provide better services. They will learn from each other. What are other counties doing? Why aren't we doing that? And the public will also ask, but Kisumu is doing this, but Turkana is doing this, but Makueni is doing this. But that will not happen if the data is not available in a centralized place for us all to see what the different units are doing.
We saw that some organizations are trying to resolve this data challenge by providing portals that give us refined data and data that can be easily used by those who need to make decisions on certain policy issues.
The most unique innovation about the Spotlight by the Development Institute is the fact that it tries to match socioeconomic indicators with budget allocations. Of course, data being a challenge means that then they are not able to do much of that to the letter. But it's a good start to try and show, are we actually putting our money where our mouth is?
So this is our first portal. This is the first one that we are having, and this is, you can go to different sections and you can be able to get what you're looking for. Yeah, but the part that particularly concerns this discussion is a part here where we are talking about the various parameters that we thought would be reasonable for determining the outcomes of health. But as you can see that we are not just in health, you know, we are looking at very many things at the same time. We are looking at infrastructure, education outcomes, incomes, health and sanitation. And under health, we have looked at so many things. We have looked at mobility, nutrition, access to water, sanitation, and even things like reproductive health. So we have clustered several parameters that we are looking at in this frame. And under of this, we have maternal mortalities, deliveries in hospitals, child mortalities, incidences of diarrhea, HIV prevalence, vaccination rates, because we thought then these would be very useful parameters in describing health outcomes. And of course, we have highlights, we have definitions. If you highlight there, you will be able to tell what that means.
So what the Development Data Hub is it's a portal that allows you to overlay socioeconomic indicators together with resources going to the ground. So you're able to see whether the money is actually meeting a need on the ground, or it's, you know, if your health indicators at county level are really good, but your education socioeconomic indicators are really poor. When you look at the budgets, you expect that the county would be focusing a little bit more on education rather than health. But basically, that's what the Data Hub wants to do.
So data, like I said, is the first step towards resolving inequalities. Once we know what our differences are accurately, then the kind of policies that we put in place, the kind of law that we put in place will appreciate this fact, and we will be able to improve our development strategy.